Hey, everybody. This is Dr. Dana Gibbs. I am an integrative physician in North Texas where I help people address their thyroid and other hormone imbalances. So many of the body changes that we associate with aging are actually the result of hormonal loss in and around menopause. So tonight, I'm going to discuss these less known effects of menopausal hormone loss, how menopause ages us, and the steps that you can take if you're serious about living your best life now and into your future. So, if you're listening to this and you're not a physician, please keep in mind scientific proof is not nearly as black and white as people think. And in order to make treatment decisions for individual people, sometimes we have to consider evidence that's not nearly as black and white as we would like it to be. And this is not meant to be medical advice, and you should consult your own physician for any medical issues or diagnoses that you might have. All right, here we go. So, most people know about hot flashes and some of the other easy to recognize menopause symptoms as a sign that menopause is on its way. And most of us ladies have heard the absolute inane advice that women hear these days. Dress in layers so you can remove clothing when a hot flash starts. Avoid foods and beverages that make you hot, like spicy foods, alcohol, coffee, tea, and other hot beverages. Drink a glass of cold water or fruit juice when a hot flash starts. Don't. Fruit juice is packed with sugar, so please don't. Reduce your stress level. Hot flashes cause stress, don't you know? No, I'm sorry. Keep a thermos of ice water or ice packs next to your bed during the night so you can wake up in an hour to pee again. Sorry, a little bit dated here. Use cotton sheets, lingerie, and clothing that allow your skin to breathe. They forgot to say keep a spare set by the bed so you can change them when they get completely soaked. But what they don't say is that hormone replacement stops hot flashes, and you shouldn't wait until full menopause to start. Why don't doctors tell you this? Well, it's because they're scared. And they're scared to the exact same reason that 90% of women stopped their hormones in the early 2000s. The fear that hormone replacement was increasing breast cancer. And I spoke all about that last week. Short version, it wasn't, it doesn't. The word is finally getting out slowly. Other docs either don't want to learn it because women are too complicated, or for some people, it may actually be too late to start. But for many midlife women, now is the time. So there are also all kinds of businesses out there that want to sell you supplements and other products to help you manage your hot flashes and menopausal sleep symptoms and your sleep problems, which you wouldn't need to buy those products if you were taking the right hormones. So there are some recommendations that I do feel are valuable, and we'll discuss those towards the end, but that is not really today's topic. Today, I want to talk about the insidious and progressive and potentially permanent symptoms that start as you go into and beyond menopause. So those are hormonal changes that occur as menopause progresses, and they are loss of bone and muscle mass, so osteoporosis, insulin resistance, heart disease, strokes, thinning skin and hair, loss of collagen and cartilage, increases in some cancers, fatigue, sleep problems, memory loss, decrease in executive function, and even dementia risk of Alzheimer's, which doubles in elderly women. And not to mention irregular periods, heavy bleeding, loss of fertility, loss of sexual receptivity, increase in discomfort with intercourse, urinary tract infections, bladder prolapse, other pelvic floor problems caused by the thinning and the atrophy of the genital tissue that result from decreasing and progressive loss of sex hormones. So these are all deficiency related, more specifically with estrogen, but the other hormones play a role as well, of course. Some of these problems are irreversible, particularly the heart and brain symptoms. And we're going to talk about more why that is in a minute. So how do we know that this is not just a normal, inevitable part of aging? Well, the answer to that can be found in looking at studies that examine women who have early menopause or premature ovarian failure, defined as either due to surgical removal of their ovaries or chemotherapy or genetics, or there are other causes. And without hormone replacement, these problems start showing up in these women right away. And this can be really young women, 30s, early 40s. And those progress at the same speed that they do in postmenopausal women just many years earlier. And surprise, if they're put on hormone replacement in time, the hormone replacement stops this early decline. And actually, the question that inspired today's topic is hearing from women whose physicians wanted them to stop their hormones once they reached their 50s, who had had this early menopause. And my question is, why? Why would their doctor want them to do that? All right. So yes, there are some reasons to consider stopping hormones. There is ongoing research in both animals and in what's called epidemiological research in humans that seems to suggest that longer exposure to hormones decreases breast cancer risk. But digging into that data, it always seems to be the oral estrogen and the artificial progestins that were used in the 90s and early 2000s. And I guess some people still use those, but those are the ones that actually get most of the blame. And there are lots of things that you can do to reduce breast cancer risk in yourself and in your offspring, in your babies that are being born now, that is more effective than stopping or not starting hormone replacement. So I'm planning on an upcoming session diving into that research in a deeper way. But I will just say that very interestingly, one of the research studies in animals that I found seems to indicate that waiting to start hormone replacement until after menopause actually increases abnormal proliferation of breast tissue, whereas starting it right away did not. That brings me to my next point. There are consequences of postponing hormone replacement therapy, and they are not trivial. As a matter of fact, when I have this discussion with my patients, this is actually where I spend quite a bit of time talking about the relative risk of increasing heart disease, dementia, bone loss versus decreasing maybe your risk of breast cancer. So what are these consequences? People sometimes think of menopause as kind of like going off a cliff. So 1 minute you're on solid ground and the next minute you're free falling. But it's actually not like that at all. So remember that while your cycles are happening, starting when they first start happening, your estrogen and progesterone are going up and down with every cycle, a bit like a roller coaster. But then they gradually run out of stimulus and slowly roll to a stop. And as menstrual cycles cease, the hormone levels dwindle with them even more. So here's a fun fact. Did you know that a man the same age will have 10 times more estrogen than a menopausal woman who is not on hormone replacement? That was a shocker to me. Anyway, so what are these conditions and diseases that happen with loss of hormones? Well, heart disease is one, and it really has to do with arterial stiffness. So my cardiologist was talking to me the other day, and he told me this fascinating fact that I did not realize. And what he said was a study that he worked on in the 90s when he was a resident addressed the physiology of blood vessels. And they actually used tiny little pressure transducers from needles that they were put into the arteries of volunteers. And they gave them estrogen and watched those blood vessels relax. And of course, relaxing blood vessels lowers your blood pressure. Great. That's wonderful. But what they found is that the older those women were, the effect of the relaxing on the blood vessels, the lowering of the blood vessels, disappeared by about 5 years after the women went through menopause. If they went on hormone replacement right away, that effect did not disappear. And it actually started disappearing within about 2 years of being in menopause. So that was just fascinating to me. And I've asked him for the write up and the reference from that study because I'm really fascinated to read the whole thing. But anyway, the other place where arterial stiffness and vascular issues manifest is in brain function. And memory problems and executive function are much more likely if hormones are not started in time. And by on time, I mean before the levels go to permanently low at menopause. So if you go too long without estrogen, those memory problems become permanent, and adding it back really doesn't do much except for put you at risk for getting arterial plaques to break off and cause trouble. Now, that problem didn't really seem to be a serious issue unless you were up to around 20 years postmenopause when you were restarting the hormones. But the benefit gradually disappeared over time from the start and the onset of menopause. Anyway, so blood vessel dysfunction gradually gets worse as women get further along in hormone deficiency. So declining estrogen also increases insulin resistance. And this results in weight gain, particularly in the visceral fat, which is your belly and around your organs where fat is particularly dangerous. And we'll talk more about this in a sec. The other things that loss of estrogen does is it starts breakdown in the joint cartilage and the skin collagen, which results in sagging skin and loss of the plumpness here in your cheeks. And this in combination can make you look and feel old as it triggers joint pains and stiffness. And these problems, the cartilage loss, is also for the most part irreversible, but adding estrogen at any age seems to stop that decline to a great degree. Maybe not reverse it necessarily, but at least stop it. Then bone loss and pathologic fractures. So bone loss starts somewhere in your 40s, and it really accelerates once you don't have estrogen, which can trigger osteoporosis, and then even something called pathologic fractures. And this probably wouldn't be something you would notice right away, but it becomes more obvious as time goes on. Because if you look at women in their 70s and beyond, they frequently start losing their height and developing something called kyphosis, which is a stiffness and a forward bending of the spine as they get tiny little compression fractures going forward. And then there are some more reversible problems with menopause. Particularly, I'm thinking of sleep problems, depression, and anxiety. Depression increases by 50% in women as they approach menopause. And this responds really well to hormone replacement, far better than it actually responds to antidepressants. All right, so hopefully I've convinced you that this treatment is worth looking at sooner than later. So how's the best way to go about doing that? First of all, I ask people to get baseline tested, maybe in their late 30s, early 40s, or if you're already kind of there, then as soon as you see a symptom that suggests possibly menopause. And I'm going to go ahead and put in the comments a website that has a pretty comprehensive list of what menopause symptoms are. But anyway, so get a baseline test checked at day 6 of your cycle and then again at day 20 of your cycle. So you'll know where your normals are. And you want to get checked progesterone, estrogen, and testosterone, and then the pituitary hormones, FSH and LH. And these are the brain hormones that signal the production and the fluctuation of those signals, the cycling part of your menstrual cycle. So when FSH starts to rise and stay high, that's when you know you're starting to approach menopause. Even if you haven't had periods for any reason, like an IUD or you've had a hysterectomy, but still have your ovaries, then after you get that baseline test, then you want to retest every few years or at the first time sign of any symptoms. Um, and in regards to symptoms, you can read that link or you can look at some of my other lives, which have more comprehensive list of menopause symptoms. And when things start to fall, start on careful supplementation with FDA approved replacement. That's typically going to be patches of estradiol, and you can get over the counter pregnenolone, or you can get FDA approved prescription progesterone. And those, of course, should be done under the supervision of a knowledgeable physician. And please don't let them tell you that your follow up testing isn't necessary and that it's okay for your levels to go higher in replacement than what your normals were when you were still cycling. It is not okay for those to go high. So the consequences of too much hormones can be unpleasant and dangerous as well. And finally, there are several lifestyle changes you can make if you haven't already as you head into menopause. And most of these are meant to help you specifically with the insulin resistance and energy and weight gain and depression. So here are my 5 steps that I recommend for people to empower you, for women or men, to empower you to embrace the getting older process, the second half of your life with grace and confidence. So thing number 1 is intermittent fasting. So this does not mean I'm recommending that you fast for days at a time. So your body interprets that as stress and raises your cortisol level. And I've talked in previous lives about why that is not a good thing. So time restricted feeding is actually a better description of what modern nutritionists are noting to be helpful. But really what it means is that you're not noshing from the minute you wake up to the minute you go to bed, that you're not getting up in the middle of the night and having a snack. If you can restrict your food intake to 10 or even 8 hours a day, then your body has a chance for your insulin levels to fall. And that is really, really good for your metabolism to have time when you have no insulin in your bloodstream. Thing number 2 is exercise, but not as much as you think. So I have seen recommendations, even from national health authorities, that recommend sustained high heart rate cardio for as much as 45 to 60 minutes a day. And that really just isn't necessary. The kind of more modern exercise plans say that you can do something called in high intensity interval training as little as 20 minutes a week to get your heart rate up. And that just gives your heart a little bit of challenge so that it just doesn't get flabby, and it helps you keep your stamina basically. And then lifting and resistance training a couple of times a week or 3 times a week, where you're doing lifting through your spine. So you're picking up something heavy with your arms and either putting it over your head or just picking it up by bending through your hip hinging muscles, things like that. So a couple of times a week where you work up to lifting heavier and heavier things. And then the third one is a light to moderate movement and stretching, something fun, something that takes mind power to accomplish, like dancing or tennis are great, maybe 3 times a week to do something like that. I mean, walking is fine, but it doesn't take much mental focus. And what you're looking for here is something that takes a little bit of concentration so that you get into the now, into the present. All right. Thing number 3 is prioritize your sleep. So if you're not sleeping well, your hormones may need to be adjusted. Or if you get that right and you're still not doing great, you may need the help of a sleep specialist. Thing number 4 is mindfulness. So prayer and meditation are two forms of mindfulness. And really, part of this practice that you need to do is something you need to do pretty much every day. And it can be as little as 10 minutes where you just sit down and write down some things that you're grateful for from the previous day. Or you can go more full on and do 30 minutes a day of a full on kind of a mantra meditation or something like that. But anyway, what you're doing is you're bringing yourself into the now rather than thinking or worrying about the past or the future or things you can't do anything about. So the kind of mindfulness that I do is a particular kind of meditation called a yoga nidra. And what it helps me do is focus my mind on calmness and joy and presence. And I use that when I'm ready to fall asleep rather than focusing on thinking about tomorrow's to-do list, which never helps me fall asleep. Thing number 5 is vary your diet. So eat what your farmer grandparents would have recognized as food, different kinds of vegetables, different kinds of fruits, not sugars and processed food and processed carbs and seed oils that are artificially pressed like canola oil or soybean oil. There are healthy oils that you can use for cooking, but really breaded and fried is not recommended. All right, thing number 6, help your microbiome out by eating lots of vegetable fiber and taking a probiotic every day. And then thing number 7, avoid toxins. We've all heard of PCBs that are present in plastic. So don't wrap your food in plastic. God forbid, don't heat your food in plastic. It's a really bad idea. Get glass microwave dishes if you need to use the microwave. But then you need to look for dyes and colors and fragrances as well, because these all have toxic chemicals as the binders and the preservatives. And then there's a few things that you don't even think about, like the thermal paper receipts that you get at the store. That ink on those thermal papers is a toxic chemical. People don't think about that. And then there's cosmetics and other beauty products that contain all kinds of ridiculous chemicals. And you don't think about that. You're putting it on your face, you're putting it on your skin, you're absorbing it into your skin. So there's a cute app that you can get. It's called Skin Deep. There's another one that's called Think Dirty. And basically you shine the camera of your phone at a label of some product you're thinking of purchasing, and it'll tell you if it's got toxic chemicals in it or not. So that's kind of cool, huh? Anyway, lots and lots of things you can do to avoid toxins rather than just go, oh, woe is me, the world is full of toxins. I'm just hosed. No, every little bit helps there. Thing number 8, drink water. Much of what people perceive as hunger is actually thirst. Particularly, do not drink sweetened or calorie-laden beverages. Your body absorbs these empty calories way too fast, and it raises your insulin to do that. Insulin in and of itself is a pro-cancer growth hormone, and besides the fact that it makes you absorb all your calories and store them away as fat. So your body even perceives non-caloric sweeteners as a reason to raise your body insulin level. And this just makes you hungrier for more other high carb, high sugar, empty calories. All right. Number 9, do uncomfortable things. Let me explain what I mean by that. We want to promote mental and physical toughness and growth. So go out in the heat or the cold to do your workouts. Consider a brief cold shower in the morning or before bed. And as far as mentally uncomfortable, do things that challenge you. Do things that seem a little uncomfortable. Learn something new. Learn something you're not good at. As long as your brain is working to help you do new and unfamiliar things, it is not stagnating. So that is super helpful. All right, last one, number 10, have a why, have a purpose in your life. Maybe it's your grandkids. Maybe it's a class that you teach. Maybe it's a project that you're working on, a reason to jump out of bed in the morning and get moving. You may have to spend some time figuring this out, writing it down, setting it up as a goal to work towards. And the more meaningful it is, the easier time you're going to have getting yourself in the habit of doing all these other things that I just talked about. All right, so I lied. There were 10 things, not 5, but they're all helpful. And even doing a few of them part of the time is a great start towards the second half of your life of being more healthy and more rewarding and more fun than the first half. All right, that's it for now. I'm Dana Gibbs. I am an integrative physician in North Texas, and I help people address their thyroid and other hormone imbalances. If you're not already signed up, sign up for my newsletter at www.danagibbsmd.com. You get valuable tips and notifications each time I do another one of these lives. And if you're a chronic fatigue or thyroid sufferer in North Texas, and you need what I can do for you to help you resolve your exhaustion, sleep issues, weight gain, come and sign up for a new patient appointment evaluation now from me at www.danagibbsmd.com. And good night, everybody. See you next week.